My grandma was the most incredible human being on this planet. She had a joy, a sense of happiness, and she taught us all how to live life to the fullest. I knew in her final time with us, I needed to create an environment where there was meaning. I really felt that I would be able to make that type of space through music. And I knew it made a difference to her because she would smile. And you know what? She would hold my hand tighter, and it was powerful. It was a super powerful experience.
There's no region in the brain that is not touched by music. And it happens often simultaneously in different regions at the same time, especially when it's music or elements of music that matters to that person.
It's one of the few things besides exercise that can light up the brain all at once and create new pathways in the brain for recovery.
It lights up the motor functions like tapping your toe or tapping your hand. It helps us to move with the music. And so music therapists are trained healthcare providers that really understand how to maximize all the therapeutic benefits and make selective choices purposefully and with intention to really ensure that while the patient is participating in music therapy, we are addressing and targeting goal areas for the patient and their specific impairments, deficits, and diagnoses.
The Calgary Zone Music Therapy Program provides music therapy services to 4 different hospitals in Calgary, and we work with a variety of units and we serve a variety of patients. There are really 4 different ways that music therapy can be used with patients and clients. We can do songwriting, we can improvise with instruments or with our voices. We can recreate our favorite songs just by jamming to a song, and we can also listen to music in a really intentional way. We work in collaboration with other allied health professionals to hone in on the patient goals and see how music can be integrated into the therapies that they're doing with physio or OT or speech as well.
I think motivation is a huge factor that we don't always think about, and why someone has the same deficit as another, but one person does a lot better than the other. I think music really taps into motivation, and that's also something that's unique about it, and that's a real advantage.
In a lot of ways, music therapy has helped shift the culture in the ICU too. It's definitely a positive influence on sometimes an environment that can be tough to be in. It's sort of a different way of connecting with the patient, and we've noticed the benefits for sure in critical care.
What music therapy does is provide an immediate reward when you're being patient for a whole lot of other things. It gives them that opportunity to go, I think I can do this for 1 more hour, 1 more day, recovery's on its way, I'm gonna be okay. So it's something that I can keep adding into my life.
We can have patients as young as 15 in our ICU and as old as in their 90s, but everybody relates to music. It's something different. It's not the machines and the beeping and the clinical sounds. It's a beautiful sound, right? And so people love and relate to that. It's a very positive influence.
It helps not only with patient experience, but with staff experience, and of course with the family members as well. I've heard from family members that it really just helps them to connect with patients and also to bring a sense of ease for them as they're watching their loved one go through something so challenging.
There's evidence that music improves satisfaction with hospital stays. It improves staff morale, and the evidence for using music to improve patient outcomes is really advancing rapidly.
The brain and central nervous system need this type of therapy to create the meatus so that the system is ready to change. What we care about is what the brain will pay attention to. It is one of the #1 drivers of neuroplasticity. And so by integrating all this with skill and knowledge as a music therapist, they really can maximize this recovery and help the system find new ways to replace what might be missing as far as their ability to communicate, move, or function.
With music therapy, there's an opportunity to really provide patient-centered care at a very deep level and connect heart to heart. It was tough to really showcase what an incredible woman she was with my own words, but I was able to do that with music. And I really feel in my heart that she heard how amazing she was to me. And for that, I'm forever grateful.